Thank you. Okay. Yes, a lot of the work that Susan was presenting on is really touches at the heart of what we do, and actually really supports this presentation, and also one of the posters that we have out there, which is called "The Con That Kills," which is around trying to get communities aware of the manipulative tactics that the industry takes, and then obviously raising support for any policy changes. So before I like to start, I'd like to acknowledge that we're meeting on Ngunnawal country, a traditional land of the Ngunnawal people, and I'd also like to pay my respects to the elders, past, present and emerging, and any Aboriginal or Torres Strait Islander people that might be here today. So this is the agenda. Maddy's doing the clicking, I'm clicking here. We figured I'm not very good at doing two things. This is what we're going to go through today. The challenge around quit and our anti-tobacco campaigns that we do. And that obviously extends now into the anti-vaping campaigns that we also work on. Looking at the audience segmentation, behaviour change state, marketing, the messaging matrix, the social marketing approach, the results, and then the lessons learned. Just bear with me a second. I can get this little, here we go. Alrighty, so effective social marketing campaigns are a critical part of chronic disease prevention. They not only support healthier lifestyles and behaviour change, but also play a key role in reducing long-term healthcare costs, easing the economic burden on the state. These campaigns improve public health outcomes by decreasing the need for expensive treatments and hospital visits. When backed by trusted organisations such as Cancer Council, they can also help drive acceptance of public policy changes, further amplifying their reach and effectiveness. Tobacco use remains the leading cause of preventable deaths in Australia, contributing to over 1.2 million deaths between 1960 and 2020. Secondhand smoke still causes significant preventable harm, and we're now seeing the added challenge of dual use, that is, people who use both vapes and cigarettes, which undermines the cessation efforts and increases the risk of relapse. And we have many academics who thought their job was done, and then vapes came in and they all went, okay, we need to sign up for another 10 years. So community and health professional engagement is also critical to the success of behaviour change campaigns. When trusted voices within the community and healthcare system reinforce campaign messages, it enhances credibility, reach and cultural relevance. Health professionals play a key role in promoting conversations about quitting, while community leaders and organisations ensure messaging resonates with and reaches priority populations, ultimately driving more meaningful and sustained behaviour change. Behaviour change campaigns complement legislation that reduce access to tobacco and vapes by addressing the underlying attitudes, belief and social norms that drive use, helping people understand the risks, build motivation to quit and sustain healthier behaviours over time. So as we spoke about, we know from evidence that smoking and vaping behaviours are closely linked. So when we are developing public education campaigns, we can't treat them as separate issues. Research shows that e-cigarettes act as a gateway to smoking for young people, even among those who were previously at risk. Among young adults, using e-cigarettes is associated with more frequent and intense cigarette smoking. While there is evidence that e-cigarettes may support quitting in clinical settings, it doesn't necessarily translate to effectiveness at a population level. In fact, sorry, I've just lost my space. In fact, former smokers who take up e-cigarettes are more likely to relapse than those who don't. At a population level, the most common pattern is dual use. People use both e-cigarettes and cigarettes, and most of these individuals are primary smokers. So complete switching from dual use to exclusive vaping is very rare. So it's really important to remember that not everyone who smokes or vapes is at the same stage of their behaviour change journey. So people have different levels of motivation, confidence and readiness to quit. And effective public education needs to reflect that. To better tailor our messaging, we segment the smoking and vaping population based on their behaviour, how they use the products, and their stage in the behaviour change. This is looking at their confidence to quit and whether they intend to quit in the near future, particularly in the next month. Understanding where different groups are on this journey allows us to create more targeted and relevant messages that meet people where they are and ultimately help support them in their move toward quitting. So, I can't read this on my slide. So, there's approximately 3.4 million Australian adults who smoke and or vape. As we mentioned, we break this down into the different segments, so people who predominantly smoke and people who predominantly vape. As you can see here, we've broken them down into the delayers, the disengaged, the prime hopeful, people who regularly smoke and who vape, people who vape and occasionally smoke, people who exclusively vape, and then other. What we then do is we look at the demographic composition of each of these different segments to help inform who they are, what they do, and what will motivate them to quit. So this is an example of the first one, which is the delayer. We look at the demographics, the perceived harms, approaches likely to be used, most likely to use for quitting smoking, factors influencing their decision to quit smoking, the acceptance of smartphone apps for quitting smoking, so we're wanting to look at things like My Quit Buddy and if they are appropriate, and then also the likelihood of using features in a digital tool. So this all helps inform the tools that we're providing them to help them on their quitting journey. This is the next one, so then we look at disengaged and we look at the differences and whether that's increased or decreased. I'm not going to go through all of these because there's a lot of information. Yep, just keep flicking through until we get to the triangle. So what we've spoken about here is we look at the segmentation of the audience, then we look at the motivations and the types of messages that we should be using to encourage people to move toward their quitting journey or down their quitting journey. So our approach in developing and delivering messages for behaviour change is grounded in in-depth consumer research. We start by understanding the needs, motivations and barriers facing our target audience through focus testing. This ensures our messaging is relevant, appropriate and effective. So our messages are based on 4 key areas depending on the behaviour change state, because it's not linear. The first one is awareness and motivation. So this is for those who don't yet prioritise quitting or don't fully understand the risks. Our goal is to build awareness and spark motivation. Messages should highlight the serious health consequences, people's vulnerability to harm, and the tangible benefits of quitting. We want to create a sense of urgency and personal relevance. Capacity and modelling. So this is where once people are motivated to quit, the next barrier is often to build confidence. For those who want to quit but don't feel able, we focus on building their capacity to succeed. This includes promoting effective supports like cessation services and medication, offering them tools to manage stress, and also sharing relatable stories about others who have been on their quitting journey and who have been successful. So in terms of reminding and revise, so people don't stay in the same mindset forever. They often get busy and life gets in the way, and quitting often drops down the priority list. That's why we need to keep reminding them that quitting is essential and an important part of their life. Next one is around removing barriers and reinforcing. So we've done quite a lot of work in terms of audience segmentation, and especially when we're looking at our priority audiences. So this could be Aboriginal and Torres Strait Islander audience, it could be multicultural communities, and also members of the queer community, so the LGBTIQA+ communities. All these communities have different barriers and different enablers to help them on their quitting journey. So this part of the messaging matrix is really tapping into those barriers and reinforcing and reminding them why they should be quitting. I'm speeding through these slides. Okay, so this slide gives a summary of the kinds of messages we need to deliver depending on where they are in this behaviour change journey. So the key principle here is exchange. What are we asking people to give up, and what are they getting in return? Varies, so the intervention needs to be tailored to each audience segment. So delayers may not see smoking or vaping as an issue yet, so often it's social and habitual. So for this group, we need to raise the awareness of the risks, as we've spoken about, and challenge pro-tobacco and pro-vaping sentiments. When we look at the disengaged, so they see sometimes quitting is just too hard and not a priority. So here it's about building that motivation and capacity that we spoke about. We can re-engage them with messages that focus on quality of life benefits of quitting, especially relevant to the LGBTIQA+ communities and also Aboriginal and Torres Strait Islander audiences. We also need to reframe quitting as a journey, especially for those with mental health challenges or those who have had failed quit attempts. This includes normalising setbacks and encouraging perseverance. These messages should extend to family, friends and health professionals, as we recognise that they have a huge impact on people who are quitting. Primed is for when people are ready to go, they just need the right push and the right support. Here it's about reminding, reinforcing and providing practical tools, and also giving them examples of where other people have quit and succeeded. Hopeful, this is where they're like, we've got this, I can do it. So this is where we know it's really important to have that social support and also be making sure we're planning. What we haven't really touched on in this presentation, but what part that's really, really important, the work that we do, is understanding priority audiences and the needs to tailor our messaging and our interventions to suit them. So, for example, LGBTIQA+ communities may see smoking as a social connector, so we need to challenge the pro-vaping, pro-smoking norms and offer affirming support. In multicultural communities, smoking can be tied to respect and hierarchy, so campaigns need to shift the social norms by showing respect for cultural identity. Aboriginal and Torres Strait Islander communities, where smoking plays a really important social role, messages should highlight the breadth of harm, challenge the norm and build capacity to quit in a really culturally sensitive way. The key takeout here is that no one-size-fits-all approach can be taken, and when it comes to smoking and vaping behaviour change. People are at different stages on their journey, and they have different motivations, channels, challenges and cultural contexts. To be effective, our messages need to reflect both the people where they're at and who they are. It's about how we truly support people on their quitting journey. So I'm going to hand over to Maddy now, who's actually going to talk about how we apply these audience segments and insights into our marketing interventions and campaign strategies.
Pass you that one. Make this a bit taller because I'm a bit taller. A lot of you may have seen, I know, way to brag. You've probably seen this structure before, and it's worked out perfectly with going before us, because I think you spoke really nicely to some of those more broader contexts, environmental contexts. But of course, social marketing, we really need to think about more than just that interpersonal and individual level. It needs to come from systemic change at multiple different levels. And that's something that we're really lucky at Cancer Council and at QUIT to be able to look at, not just within our team within marketing, but also working with community systems, with our health promotion team, and also with our research team. So holistically, what this looks like for us is a whole mix of different types of activities, and this little puzzle doesn't even cover all of them. It's just the ones that we're going to touch on slightly today. We have a whole bunch of different integrated marketing communication campaigns with different messages targeted at the different audiences that Kel was mentioning before. We talk about health harms, which are motivational messages. We talk about capacity and building that belief in the ability to quit. We also talk about targeted campaigns with the tools and the support to quit to our primed audiences. Also those specific priority community messages to make sure that we're reaching those audiences with the right messages where they are at. Beyond that, there's also obviously a huge amount of work around vaping and denormalising and any upcoming tobacco or nicotine products as well. We also do a lot of work within the public advocacy space. Obviously, before Sue was talking about the amazing retail licensing schemes finally that are coming to place. But there's also been huge changes in plain packaging, in menthol bans, which have all come into place, which a lot of advocacy work has gone into, not just from us, but from across all cancer councils and a bunch of other organisations, Vic Health as well in the back corner there. And then, of course, community systems is super important to us as well. We know that in particular priority audiences, it's really important to get into that community level, and as well at a local LGA level, there's a lot of work that needs to be done. And finally, that health promotion workforce is also really important to that support system. Bringing this to life from the individual and interpersonal interventions, this is more of our integrated marketing communication campaigns and how we phase it. We know that 8 to 12 exposures per quarter tends to be the best way to go about it, to make sure that you've got that sustained narrative and to make sure that you've got the saliency of messaging. But also, given there are so many different audiences and different types of messages we need to touch on, we need to think about that. So the way we go about it is we have a look, obviously, at what we can pull from nationally, because unfortunately we don't have the budgets to do 8 to 12 exposures per quarter, as we'd like to, and we start to layer within that. In the past year, this is what it's looked like. We've had motivational campaigns from national with Choose Your Hard. The con, from a delayer and disengage point of view, that poster is outside. It touches on industry manipulation. And more recently, Sounds Like, which is a brilliant campaign from Cancer Council WA. From a capacity point of view, we recently launched our One Step campaign, which really talks to taking quitting one step at a time. It's not going to happen overnight. We don't expect you to be able to do it without any slip-ups. We're normalising kind of how it actually happens. We also have always-on elements to make sure we're capturing those who are ready to quit. We know there are people all throughout the year who are going through that phase, so we want to make sure we're there to support them. And then obviously as well, we've got our priority community campaigns. Hanky was for multicultural audiences, Find Your Way for LGBTIQA+, and we've also got Keep It Quitting, which was the national campaign for Aboriginal and Torres Strait Islanders. As mentioned before, there's also all the societal, environmental elements as well that go into everything we do. So beyond those integrated marketing communication campaigns, there are things like the community health promotion workforce, where there's a forum where health promoters can discuss and interact with one another and seek and share useful information. There's amplification of partner activities as well. There's all the research that goes into smoking and vaping to really help identify those key barriers and facilitators to help extend our work. There's advocacy efforts, which we've already mentioned before as well, cessation platforms like Quitline, and all the digital tools that we're starting to try to build to reach some of those younger audiences as well. Health professional education, school vaping resources. That's just touching on a few because we've only got 20 minutes for this presentation, but we could talk all day about them. In terms of the impacts, we're really lucky to have amazing research at Cancer Council and amazing evaluation, and what can be shown from it is that the social marketing activities we do actually does really, really work. You can see here that when we have social marketing activity, there are peaks in Quitline calls, so we see a lot more Quitline calls coming through when we've got activity running, and even more so what's great to see, and it really talks to that layering of messaging, when we have more than one messaging running at once, we see even stronger impacts as well. So some of those bigger peaks are when there's multiple messages in market at once. So lessons learned, final slide, we're going to make it in 20 minutes. An audience segmented approach is really crucial for addressing those diverse motivations and barriers, especially as well with those different target audiences, really tailoring those messages to the individuals based off their stage of readiness to quit, and to really ensure that we're giving those relevant and effective interventions. Secondly, a continuous always-on approach is really important for that sustained behaviour change. As we mentioned before, people looking to quit at different times of the year. Quitting is not a linear process. So we want to make sure that we've got messaging running throughout the year, and we want to make sure that that messaging also talks to the different priority communities in a culturally sensitive way. Finally, the necessity for ongoing support throughout the quitting journey is definitely evident, especially from those results before for services like Quitline. So we really need to make sure that we're supporting and having those services running, especially for those higher risk groups who face additional challenges. I just wanted to finish by saying we're only 2 people in a large team. These are a few other people who've contributed to this. There are many more at Cancer Council and Quit as well, but we just wanted to make sure that we had their beautiful faces up here as well today.